Well, getting a good night's sleep may seem like a dream for people, whether you're wired with thoughts running through your brain or who knows what.
Maybe your sleep schedule is off, or it could be a bigger problem, falling asleep, such as sleep apnea. Here with some insight, Dr. Lindsey Hans of Hans Family Dental. Nice to have you. What are people experiencing during a visit? And do the people come to you a lot with these kinds of issues?
What our office does is we see a lot of people who have been diagnosed with sleep apnea, but they can't tolerate wearing their CPAP machine. And for those people, they're really looking for another method of treatment, and that's what our office provides.
Okay, we're talking sleep apnea. What exactly is sleep apnea?
When you have sleep apnea, what happens is the back of your throat basically closes shut while you're sleeping, and it prevents you from breathing properly for periods of the night. And as you can imagine, when you're not breathing for long periods of the night, night after night, that has a really detrimental effect on your overall health.
Yeah, now you don't diagnose people with sleep apnea. They just come to you afterwards.
We do not. Whenever you're diagnosed with sleep apnea, that happens from your physician. A sleep physician needs to diagnose that after a sleep study. And then patients are usually prescribed a CPAP machine to wear. A lot of times, unfortunately, the patients can't tolerate wearing the CPAP machine.
And problems can arise, too, if sleep apnea isn't diagnosed.
Correct, yeah. There are a lot of detrimental problems. You know, when you're not breathing, you're not getting enough oxygen. Oxygen, obviously, very important for your body. So untreated sleep apnea is linked from everything from high blood pressure, increased risk of heart attack, stroke, type 2 diabetes, obesity. You're also at risk for things that happen when you don't get enough sleep, such as motor vehicle accidents, things like that. So
now, I know those CPAP machines are big and bulky. They probably wouldn't be the most comfortable thing to wear when you're sleeping. Do you have to have a CPAP machine to treat sleep apnea?
A CPAP machine is considered the gold standard for treatment of sleep apnea, but unfortunately, a lot of people, when they come to us, they say, I just can't wear it. The mask blows air in my face, it's uncomfortable, it makes me claustrophobic. Some people try in good faith to wear it, but then they find that they take it off in the middle of the night just unconsciously.
Yeah. So Dr. Hans, what do you recommend then? You have some alternative options for people that can't handle that CPAP machine, who still want to be able to have a good night's sleep.
At our office, what we make are oral appliances for the treatment of sleep apnea for people that can't wear their CPAP machine. All of these appliances are FDA approved for the treatment of sleep apnea. And there's a couple different designs, but they all have the same basic components.
So how do they work exactly? If we're looking at this one, because obviously this isn't like providing oxygen to you, so how does it help you breathe, I guess, if you stop?
Sure. How it works is there's all of them have the same basic components. There's a part that goes over your upper teeth, a part that goes over your lower teeth, and the way that those parts fit together, it actually holds your lower jaw in a more forward position than it usually is, and that creates space in the back of your throat so that you can breathe properly.
Wow, okay.
Yeah.
Okay, now, are they painful? Because that looks like it has like some kind of screws or something in it, or is that just for the model?
That is just for the model. Okay. They're nice and smooth. It's very similar to what you would think of like an athletic mouth guard or an orthodontic retainer. So patients tolerate them very, very well. They're used to them very quickly, and they come in telling us, you know, I feel more rested in the morning, I have more energy throughout the day.
Is this similar to what I wear a guard at night because I grind my teeth? Is this similar to that?
It's a similar construction, it's just that there's more components to it, because the guard usually is just over the top part of the teeth, and this has top and bottom, so it can hold that lower jaw forward.
Yeah, with an intent, right, exactly, because you're making that space so you can breathe more deeply.
Exactly.
Is this covered by insurance?
It is. Sleep apnea is a medical condition, so these appliances, even though I am a dentist and they're made as a dental appliance, they're covered by your medical insurance.
And once you get like fitted for one of these, how long does it take before you can get it?
Usually it's, we take impressions of your teeth, and within 3 weeks we have it back at the office for you. Yeah.
Well, this is so interesting to me. I had no idea that you could cure, or not necessarily cure, but help sleep apnea with your teeth.
Absolutely. It's definitely a great option for treatment for people that can't tolerate their CPAP machine.
Dr. Lindsey Hans is part of the IllinoisHomepage.net Premium Health Connection. Thanks for being here. We appreciate it. We'll get you connected via CILiving.tv and IllinoisHomepage.net. Well,